What is the primary purpose of measuring a patient's post-dialysis weight? A. To determine blood pressure changes. B. To calculate the amount of fluid removed during dialysis. C. To evaluate hematocrit levels. D. To monitor dialysis adequacy. Answer: B. The difference between pre- and post-dialysis weight indicates how much fluid has been removed from the patient, helping to assess if the fluid goal was achieved safely. When initiating dialysis, the venous pressure suddenly rises. What should the technician do first? A. Increase the blood flow rate. B. Stop the ultrafiltration. C. Check for kinks or clots in the venous line. D. Flush the arterial line. Answer: C. A sudden increase in venous pressure may indicate obstruction or clotting in the venous bloodline. The technician should inspect for blockages before taking further steps. Which of the following best describes an arteriovenous (AV) graft? A. A natural fistula created between an artery and vein. B. A catheter placed in a central vein. C. A synthetic tube connecting an artery and vein. D. A temporary hemodialysis access. Answer: C. An AV graft is an artificial connection used when the patient's veins are unsuitable for a fistula, providing a reliable access for dialysis. A dialysis patient complains of metallic taste during treatment. What is the most likely cause? A. Hypotension. B. Dialysate contamination. C. Dialyzer reaction. D. Air embolism. Answer: B. Metallic taste is commonly linked to dialysate contamination with chlorine or chloramine. The technician should stop dialysis and report it immediately. During dialysis, the conductivity alarm sounds. What is the safest first action? A. Check dialysate temperature. B. Recalibrate the monitor. C. Bypass the alarm temporarily. D. Stop the blood pump and verify the dialysate. Answer: D. Conductivity alarms indicate incorrect electrolyte concentration. The technician must stop the blood pump and check dialysate safety before continuing. Which condition may occur if the dialysate temperature is too high? A. Hypothermia. B. Vasoconstriction. C. Hemolysis. D. Thrombosis. Answer: C. Overheated dialysate can cause red blood cell rupture, hemolysis, leading to severe patient complications. Why is bicarbonate used in the dialysate solution? A. To maintain potassium levels. B. To buffer and correct metabolic acidosis. C. To enhance solute removal. D. To prevent hypocalcemia. Answer: B. Bicarbonate acts as a buffer to neutralize acids accumulated in the blood, maintaining a stable pH level. A patient's venous access site shows redness and drainage. What should the technician do? A. Apply warm compress. B. Notify the nurse immediately. C. Proceed with dialysis as scheduled. D. Flush with saline and recheck. Answer: B. Redness and drainage may indicate infection. It must be reported to the nurse before starting dialysis to prevent bloodstream infection. What is the most critical step in preventing cross-contamination between patients? A. Using sterile gloves. B. Changing dialyzers between patients. C. Hand hygiene before and after contact. D. Wearing face shields. Answer: C. Hand hygiene remains the most effective and essential practice in preventing transmission of infection in dialysis units. Which of the following best defines ultrafiltration? A. Movement of solutes through a semi-permeable membrane. B. Removal of excess fluid from the blood using pressure. C. Exchange of electrolytes across the dialyzer membrane. D. Filtration of toxins using activated carbon. Answer: B. Ultrafiltration removes fluid by applying transmembrane pressure to push water across the dialyzer membrane. What happens if a dialyzer is not properly primed before treatment? A. Hemolysis may occur. B. Air embolism may occur. C. Conductivity may drop. D. Blood clotting may begin. Answer, B. Inadequate priming can leave air in the dialyzer, which may enter the bloodstream, causing a dangerous air embolism. What is the best indicator of dialysis adequacy? A. KT/V ratio. B. Blood pressure. C. Urea concentration. D. Post weight. Answer, A. The KT/V ratio measures urea clearance and time of dialysis, determining how effectively toxins were removed from the blood. Which lab result indicates poor phosphorus control? A. Elevated serum calcium. B. Increased serum phosphate. C. Low potassium. D. High albumin. Answer, B. High phosphate levels suggest inadequate dialysis or non-compliance with dietary restrictions, increasing risk for bone disease. During dialysis, the patient complains of muscle cramps. What is the first appropriate intervention? A. Stop the treatment. B. Give oral fluids. C. Decrease ultrafiltration rate. D. Increase dialysate sodium. Answer, C. Reducing the ultrafiltration rate can relieve cramps by decreasing rapid fluid removal and improving blood volume. What is the primary function of a heparin pump in hemodialysis? A. To control dialysate flow. B. To prevent clotting in the extracorporeal circuit. C. To regulate ultrafiltration pressure. D. To add electrolytes to the dialysate. Answer, B. The heparin pump delivers anticoagulant continuously to prevent clotting in the dialysis circuit. A dialyzer's clearance is affected most by A. Membrane surface area. B. Needle gauge size. C. Conductivity. D. Ultrafiltration pressure. Answer, A. Larger membrane surface area allows more solute diffusion, increasing dialyzer clearance efficiency. What is the main risk of recirculation in vascular access? A. Increased KT/V ratio. B. Poor solute clearance. C. Low venous pressure. D. High conductivity. Answer, B. Recirculation causes already cleaned blood to pass through the dialyzer again, reducing toxin removal efficiency. The first step when a patient develops hypotension during dialysis is to A. Stop ultrafiltration. B. Give a saline bolus. C. Decrease blood flow rate. D. Stop dialysate flow. Answer, A. Stopping ultrafiltration prevents further fluid loss and helps stabilize the patient before additional interventions. A patient's access needle dislodges during treatment. What is the immediate action? A. Press the alarm reset. B. Clamp the venous line. C. Apply pressure and stop the blood pump. D. Restart the treatment. Answer, C. A dislodged needle can cause significant blood loss. Stopping the blood pump and applying firm pressure prevents further bleeding. The correct order for reprocessing a dialyzer is A. Clean, disinfect, rinse, test. B. Rinse, clean, disinfect, test. C. Clean, test, disinfect, rinse. D. Disinfect, clean, rinse, test. Answer, B. Proper reprocessing ensures safety and functionality by rinsing, cleaning, disinfecting, and testing the dialyzer. Which type of hepatitis has the greatest concern in dialysis centers? A. Hepatitis A. B. Hepatitis D. C. Hepatitis C. D. Hepatitis B. Answer, D. Hepatitis B is highly contagious and resilient. Strict infection control protocols are required in dialysis facilities. What is the key reason to monitor arterial pressure during treatment? A. To detect air in bloodlines. B. To ensure proper blood flow from access. C. To measure ultrafiltration. D. To verify dialysate mixing. Answer: B. Monitoring arterial pressure ensures adequate blood withdrawal and early detection of access-related problems. What is the safest way to verify the correct dialyzer before connecting it to the patient? A. Check the serial number on the label and chart. B. Ask another technician. C. Match by patient's name tag. D. Use color coding. Answer: A. Verifying the dialyzer's serial number ensures each patient receives the correct reprocessed dialyzer, preventing cross-use. Why must conductivity and pH be checked before dialysis begins? A. To confirm heparin dose. B. To ensure proper dialysate composition. C. To adjust ultrafiltration rate. D. To test blood flow. Answer: B. Testing pH and conductivity ensures the dialysate has safe electrolyte and bicarbonate levels for patient safety. Which symptom suggests an air embolism during dialysis? A. Headache and dizziness. B. Chest pain and shortness of breath. C. Fever and chills. D. Muscle cramps. Answer: B. Air embolism presents with chest pain, dyspnea, and hypotension. Treatment involves stopping the pump and positioning the patient on the left side with head down.